St. Francis Hospital opened on October 16th, 1924. Now, in its centennial year, St. Francis Hospital is transforming the way Northern Delaware is thinking about healthcare. The Healthy Village at St. Francis Hospital is a new model of care that encapsulates whole person, whole life healthcare with the support of community partners. Now, looking to the future of St. Francis Hospital, we are joined by Jim Woodward, President and CEO of Trinity Health Mid-Atlantic, which St. Francis Hospital is a member, and Gina Kennedy, Regional Director of Philanthropy. Thank you both for joining me today. I have some questions for you, but first, I'd like to congratulate you both on the centennial.
Thank you. We're very excited.
It's so exciting. So, Jim, I'll start with you first. Can you tell me a little bit more about the history of St. Francis Hospital and maybe a little bit about what's been going on these past 100 years?
Sure. So 100 years, very exciting. But as with most of our hospitals, the Sisters of St. Francis, in this case, identified a need for healthcare in the greater Wilmington area, 100 years ago, and where there was a dearth of acute care services available to the community. So they decided, with help from Philanthropy as well as help from the Catholic Church, to establish one of the first hospitals in the state. And that was the beginning of St. Francis Hospital. Basic services for an acute care hospital, emergency room, et cetera, all that were needed. And at that time, up on the hill, as we call it, there was largely an immigrant population, mostly Italian immigrants, who were very vital to the community in terms of the workforce. And since then, we have really morphed. We've changed a lot over that 100 years to the point where today we're a much smaller organization. We were originally built for well over 300 beds. Over the years, we grew. Today, we operate about 70 beds. So one of the things that the Sisters of St. Francis brought to our philosophy of delivering care is, what is the need that the community has? How best can we fill that need? And secondly, don't stop there. As the needs change and as the community changes, how do we continue to adapt and refine what we do to better meet the needs of the community?
So you kind of answered my next question then about how healthcare has evolved over these 100 years. Do you find yourselves more agile now that there's fewer beds and you're able to kind of focus more on the community?
I'd like to think so. Over the last, I would say 30 years, I've been in this field for 38 years, and about the last 30 years, hospitals in many communities have been asked to take on more social services. So the need for acute care services has moved more to the outpatient setting. So we don't need as many hospital beds. We provide care more in ambulatory surgery centers and ambulatory clinics, doctors' offices. So we've adapted to that. But most importantly, every 3 years or so, we do something called a community health needs assessment. And the purpose of that is to really interview, in essence, the community to find out what are the needs, what are the top 10 or top 5 areas where the community is lacking in healthcare delivery and healthcare services, and how can we better meet those needs going forward? So 10 years ago, a lot of it was general surgery, a lot of it was robotic surgery, a lot of it was OBGYN services to the community, and we're the only birthing center in the city of Wilmington, celebrating, by the way, our 40th anniversary there. But we had the general acute care services and, of course, the importance of the emergency room. But today, we've shifted a lot towards more behavioral health services, more substance abuse services that the community needs. As we've seen a change in economic status in the neighborhood, we've also seen a change in educational levels in the community. So the number of people that don't have jobs is also a significant factor. And many of our employees actually come from the immediate community. So not only are we there to provide health care to the community, we're there to fill gaps that exist today that are different than they were 5, 10, 15 years ago or 100 years ago. And we also serve as a major employer to the communities that we serve.
That's wonderful. Yeah, it's so neat hearing about folks who work at your hospital who are directly from the community, because I think they're probably best suited to serve the needs of the community.
Very
then.
definitely.
That's
They know
wonderful.
better than we do.
Right.
Yeah.
Exactly. That's wonderful. And that's perfect because I think I'd love to just get Gina's weigh in on this as well, because I know you're so involved in your role with kind of what Trinity Health means to the community. How would you say it's evolved in the time where you've been with the hospital?
So it has taken quite an evolution over the past 100 years. Just recently, I think, in light of what we have seen with the pandemic, more outreach to the community, more advocacy efforts working with both community leaders as well as legislators, elected officials. And I think it's an ever evolving healthcare system based on what we've seen lately with the inequities in health and social status, housing. Most of the efforts are focused on outreach and making sure that we can address those the inequities both in health and housing and education within the healthy village.
That's incredible. It's so funny because you think about a hospital and you don't think about touching on education and housing. So it sounds like you're so much more involved in the community than just being this kind of one-stop shop of hospital care.
And that is the beauty of Healthy Village, where we have wonderful resources in Wilmington, Delaware, great partners, but they are all spread out. With Healthy Village, that will allow us to have those partners providing social services to our patients within the confines of the hospital, so that, you know, when we have patients coming in that possibly don't need clinical care, we can refer them to the appropriate social services within the hospital. And in a lot of cases, those individuals don't have the resource to either make that call or get the help themselves, or in some cases, transportation. So having those partners within the hospital is a very novel idea and one that makes perfect sense in the environment that we're in.
I think that's so commendable. That's incredible. What would you say, Gina, has been the community response to an effort like Healthy Village?
You know, there is a learning piece, and I think we have done, the team has done an excellent job in educating the community on what Healthy Village means and what it is. And I think one of the best, I guess, responses that we have had is the security that our folks, that the community feels, knowing that St. Francis is not going away. The Healthy Village is actually part of the hospital. It is not something separate. It is, St. Francis is the Healthy Village. So I think that there is a lot of comfort in knowing that individuals can walk in for their care, which a lot do. And those individuals that have been receiving care for many years can still come to the hospital for their acute services. And if they need help with social services, it's an added bonus.
That's amazing. They just know they can rely on you.
Absolutely.
I love that.
Absolutely.
There's a very high, one of the things that we've learned from our communities is there's extremely high trust level of St. Francis. They're not going to be judged. They're not going to be turned away. And we're going to give them resources beyond which they present to the hospital for.
Right.
So one of the premises behind establishing the Healthy Village was, one was a little bit of a selfish motive, I'll admit, and one was a community focus. The selfish motive is that we have this large building that was built for 400 beds, and we're operating 70. So we have a lot of empty space in the building. And the community-minded piece of it is what I mentioned earlier, which is the needs have changed. And the services that we were providing 2 years ago were not necessarily the same services that the community needed today. So we came up with this novel idea, and I want to credit Lillian Schoenwolf for this in large part, who's our Director of Community Health and Wellbeing, to really look at creating a unique, and this would be the first of its kind in the United States, and a healthy village that exists inside an acute care hospital. So as Gina mentions, if you come into the emergency room and you need behavioral health care, we're going to link you before you leave the hospital. If you come in and you have a need for a wheelchair at home, but you don't have access to one, we're going to get you the wheelchair that you can take with you. If you're in need of hospice services. Delaware Hospice is located in our building. If you're a woman who was just released from prison, we have a women's reentry program. So it helps with transportation, it helps with clothing for interviews and things of that nature. We have street medicine. So we do a variety of things, but we have a lot more to do. But rounding out that concept of what does the community need, how can we best meet those resources, and how can we make better use of this building that's in the heart of a community that needs the resources the most.
Incredible. I'd love to touch too on something that you mentioned earlier about the maternity ward, because I know it sounds like you've just served the community in all these fulsome ways, but I know OBGYN care, maternity care can be a huge help to growing families. And is my understanding it's the only one within the Wilmington city limits?
It is. And as I shared, we're celebrating our 40th anniversary, but it is the only one within the city. And I think transportation would be an issue for a lot of our population. Prenatal care is a big issue for a lot of our population. So we're thankful that we have a number of excellent employed OBGYNs that provide that community care in their offices and make sure that women are getting the appropriate care they need so that when they do deliver, it's uncomplicated and hopefully a normal delivery without any issues. But we also have a neonatology program there. So if there is a need for some greater intervention, that's available. We're very proud of that because many hospitals across the country have vacated providing OBGYN services, unfortunately, especially in underserved or poor communities. So, and the ones who suffer the most there are the Black and brown community. So we feel very good about the fact that we've been able to maintain that in Wilmington.
So celebrating 2 anniversaries this year then.
2 big anniversaries, among
huge.
many that we've celebrated. A lot of firsts that have occurred at St. Francis over the years, and we're very proud of that.
And I'd love to, we've talked so much about everything you've accomplished in the past 100 years, and then specifically the past 30 years, and then I think 12 and 8, if I'm remembering correctly. Yep. Let's talk about what you both envision. I can start with you, Gina, the next 100 years looking like.
Sure. So I think that we will see more patient-centered care. We already are focused on providing that patient-centered care involving family caregivers in the clinical help with the patients. It provides greater outcomes. It helps with the healing process. I believe that collaboration with community partners will be even more so looking forward to the future. One thing that I believe very strongly is that we learned through COVID that we work together better collaboratively. We do really need the community partners. We need help from our federal and local governments. And I think that going forward, it will be more of collaboration and more patient-centered care.
Thank you. That's great. And I'd love to hear from you as well, Jim.
Yeah, I think you're always going to see, and this has always been a concern, I think, over the last probably 20 years, is the hospital still going to be there in the next 100 years? The answer is yes. And I think the fact that the sisters and Trinity Health continue to morph St. Francis to what the needs are in the community ensures that we're going to have a healthy future. So I think you're always going to see the emergency room. You're always going to see the stable of services that we offer today from an acute care standpoint. But you're going to see the physical plant and the building change a little bit. We're going to have more behavioral health services. We're going to have more substance abuse related services. You're going to see in our parking garage behind the building, we've just initiated a study to give the air rights to another organization, another community partner that would build senior housing, affordable senior housing above that. And the idea long-term is to connect that into the hospital. So our seniors who don't have, in that community, who don't have the ability to afford many apartments or leased space for their residents, they're going to have the ability to be right in the community where they grew up, have affordable housing, but also have direct access to healthcare. So I think looking at those kinds of things is going to be critical for us. But also, I think you're going to see an expansion of more ambulatory or street medicine, I call it, but that's maybe unfair, but more mobile medicine in the community at large. So going off our campus.
Incredible. So a very busy next 100 years. Well, I just have to hear then, what are you doing to celebrate, I hope, the past 100 years?
We just most recently celebrated the Feast of St. Francis on October 4th with lots of activities for colleagues to celebrate the centennial. We have a big celebration coming up on October 24th, which will unveil an open house for Healthy Village as well as celebrating the centennial for St. Francis. And that is open to the community, colleagues, family members.
Oh my gosh, that sounds like so much fun. Wow.
We're looking forward to
A
it.
lot of goodwill
Exciting.
going around. Well, you have a lot to celebrate.
Thank you.
Yeah, we do.
I would like to thank Jim and Gina for joining me today to talk about St. Francis Centennial. Be sure to stay tuned to the Trinity Health Mid-Atlantic social media pages for more about the open house event on October 24th. Be sure to hit subscribe and stay tuned for more episodes of Beyond the Stethoscope.